All right, good morning. Thank you all for joining us today for a discussion on the state's preparation for July 16th, which is the beginning of the rollout of the 988 National Dialing Code for Suicide Prevention and Crisis. My name is Ashley Fielding. I'm the Assistant Commissioner for Agency Affairs at the Department of Behavioral Health and Developmental Disabilities. And joining me today are 4 members of our in-house planning team for 988. In the next half hour, we'll provide you with an update on the state's progress in planning for the rollout and review the challenges and opportunities ahead as Georgia begins the long road toward one of the largest federally mandated crisis response transformations in decades. As I mentioned, you'll get to meet members of our in-house planning team who are working on all aspects of our planning and implementation, from the call center all the way to the crisis receiving centers. And we should have plenty of time after that presentation for your questions. We have one change in schedule from our invitation. Commissioner Fitzgerald encountered a last-minute conflict and will no longer be able to join us live today. However, she did not want to miss the opportunity to speak with you on such an important initiative. So if you'll all, before we move on with our presentation, we're just going to share a quick recorded message from her. Brian, will you share the video for us?
Thank you for joining us today for an update on our planning for the largest transformation in behavioral health crisis response our state has ever seen. The rollout of the 988 dialing code comes at a time when mental health is front and center in Georgia and across the country. Calls for help are already at an all-time high as a result of the stress related to the pandemic. We are at the beginning of an unprecedented opportunity to reduce stigma, enhance access, and build services with the ultimate goal of saving more Georgia lives from the tragedy of suicide and overdose. Here's what we know. 988 will frame our understanding of the true demand for behavioral health services in our state. And we expect that it will reveal the needs of Georgians more than any other work we've undertaken to date. 988 is the first broken ground on a major construction project for our nation's behavioral health system. We will be designing, building, and remodeling for the years to come. This is not unlike the development of 911, which took more than 30 years to cover 93% of the population and is still under development. Just like 911 redefined emergency response, 988 will shape how we build our crisis system. But with one key difference. Since the rollout of 911, people have become more savvy with technology and have the ability to adopt technological advances more quickly. As a result, demand, and along with it, expectations will rise quicker. This will challenge each state to build a system that will adapt to changing needs and technologies. Right now, we are working under federally mandated and accelerated timelines to prepare for 988's rollout. When the dialing code goes live on July 16th, it is day one of a job that will never truly be done. We are so grateful for the support of Governor Kemp and the General Assembly and their partnership in expanding the number of crisis beds available in Georgia this year, enhancing our current crisis call center, and increasing access to outpatient services, all of which will help us to lay the foundation for the long road ahead. What's most important is this. The 988 transformation is life-saving work, and you are an integral part of its success. Thank you for joining us today, and thank you for your commitment to partnership as we build a mental health system that is accessible, accountable, and dependable. Over the next half hour, you will hear from several experts on our team who are boots on the ground in this planning process for Georgia, and who can speak to the opportunities and challenges ahead. We welcome your questions. We value your input. We are also deeply grateful for those of you who have already been such a large part of this work. We want you to stay engaged. We know that Georgia families and communities are counting on all of us, and we cannot do this work without you. Thank you.
Thank you, Commissioner Fitzgerald. That was a great message and a way to lead in the conversation we're going to have today. My name is Monica Johnson. I work here at the department. I am the division director for behavioral health. I've been here with DBHDD for 11 years, almost 12 years in a few months. And prior to coming to the department, I worked in the community behavioral health system. I've spent my whole career in behavioral health. I'm a licensed professional counselor by trade and have a total years of experience of 26 years in this field. I'm excited to have this conversation with you all this morning to do a little bit of table setting and talk about what's next and what we're working on here in Georgia related to the beginning of our rollout of 988. Next slide, please. So as you already know, if you're here today, at least the first thing you know is that we're talking about a 988 three-digit number that individuals will be able to call, the individuals that are in a crisis related to behavioral health, related to suicide prevention, any crisis under the behavioral health umbrella, individuals will be able to call 988. This will be a national number. This will be effective July 16th of this year. And again, what we're focused on is making sure that people are able to be connected to trained staff individuals who can help address and respond to immediate needs of individuals that are in crisis seeking help, support, or treatment. This will be available 24 hours a day, 7 days a week, and 365 days a year. Next slide, please. So we see this as an opportunity. You heard me say I've been in this field for 26 years. Some of you out there may have a longer career than me, but what I can say for sure is this is the most transformational initiative that I have seen that will forever shape and change the way people reach out who are in crisis. This is a positive thing. Having a way to divert individuals to the right places when they're in crisis is going to be exceptional. This will be able to allow us to meet the rising needs of individuals with mental health, substance abuse disorders, and suicide interventions. The last few years have shown us that the demand is higher and it will probably continue to grow. This definitely will be the largest federally mandated crisis response transformation that has taken place in decades. So the key features, key points that I think are really important to think about when we talk about what this means for us. Connecting a person with immediate and ongoing resources is number one. It also promotes cost efficiency, reduces the impact on law enforcement and safety resources if you are able to direct individuals that are in a behavioral health crisis away from 911 into 988, quickly connecting them with the professionals and the support that they will need. It will also help end stigma for individuals who are experiencing a crisis, but may be hesitant to reach out for care. Next slide. So we put these in three buckets. I kind of did that on the last slide, but I want to break it down just a little bit more. We learn in different ways. So first bucket, thinking about our first primary role here is to make sure as we begin to do this, what will be a slow rollout and will take some time. But the first thing we need to be prepared to do as a state is to have a way for people to have someone to talk to. Somebody needs to be on the other side of the phone when the individual dials that number. We also already have peer-run warm lines. We will continue to enhance that capacity. This is really important, a really important part of this whole system. Having someone to answer the phone that is licensed, credentialed, has all those things. But what we know in Georgia is that recovery works and peer support services work. There's nothing like the value of an individual experiencing a crisis and gets to hear someone that also has shared lived experiences. So we will be enhancing that. So once you get someone to talk to, the next step could possibly be someone to respond. So that may look like mobile crisis. We have mobile crisis statewide now, but enhancing that to make sure that we can respond and go to where the individual is when that is the appropriate response. Coordination with 911 or EMS as appropriate. And then, of course, making those connections to outpatient community provider responses. And then lastly, having some place to go for the individual after the initial contact is made and it is warranted. Crisis stabilization units will be critical in this. Our crisis service centers, our peer wellness, respite opportunities, detox and substance use treatment, inpatient beds, as well as other outpatient crisis type services. I do want to say, and I'm going to say it probably more than once whenever I get the mic, that it's important to keep something really critical in mind. While we are very anchored to talking about crisis because we're talking about a crisis line, it is extremely critical to remember that the best way to prepare for 988, in addition to the things that you're going to hear about today, is to make sure we keep our eye on the ball of building non-crisis services. The best way to prevent a crisis is to work on that before. So while we're crisis heavy in conversation today, please remember how important it is to prevent crisis where we can and continue to build upon the foundation of the behavioral health system, which does not mean you have to enter the system when you're in crisis. So keep that in mind, and I'm going to underscore that every time I get an opportunity. Next slide, please. This slide has a lot going on, so I'm going to tell you the most important thing I think for you to remember is that right now we already have a Georgia Crisis Call Center. So we have that. Not every state has that, and that's a very positive thing for Georgia. So right now there's already capacity around how people access our crisis center that we currently have. So rather they call our 1-800 number that's associated with our GCAL call center. Rather they call, rather they chat, rather they text, those features are available now. Current and future national suicide prevention calls already go into our crisis line. You can see other areas in which our current crisis system, our call center, has the capacity to do a lot of things now. We will be spending a lot of time making improvements and enhancing as we prepare to receive new 988 calls. Next slide. So, kind of hearkening back to what the commissioner said to you all earlier, again, this number will be available July 16th of this year, so in a couple of months. But remember that this will be an initial step. That July 16th date is an initial step to a very long-term transition to get to where we are. Remembering that it took 911 30 years to be able to cover 93% of the population. And 911 continues to evolve even today. We will take those lessons. We will take all of the things that we can learn from that transformation, apply it to this rollout, and begin to make our transition as we gear up for what's going to be a very brand new world. Next slide. So this was recently released, and it's important because this is SAMHSA's view. So SAMHSA put out a 5-year vision for 988. What you're going to see here is similar to what we've already been planning for on our own as a state. So it helps us to know we are on the correct trajectory. So again, SAMHSA's plan is to have someone to talk to. So first, crisis contact centers. We have a call center already. Their goal is that 90% of all of the 988 contacts will be answered by the state by 2023. So as you can see, they have goals that are set out into the future, also anticipating that it is going to take some time to build and get where we want to be. You will see that they have mobile crisis services, someone to respond to. Georgia already has mobile crisis that covers the entire state. we'll continue to enhance that to be able to respond to anticipated demand in the future. But you'll see the targets that are here on the slide that SAMHSA is looking for. And then lastly, stabilization services. So we are aligned with the vision of the federal government, and we've been doing our work on our own as well. And so we're excited that we seem to be going in the right direction and that we will be taking this in incremental steps. Next slide. So we're going to transition. I'm going to bring on Don Peel. Don is our director for the Office of Crisis Coordination to talk more specifically about our planning efforts here in Georgia. Don?
Thank you, Monica, and good morning, everyone. As Monica said, my name is Don Peel. I'm the director for the Office of Crisis Coordination for DVHDD. I've been with the department for over 10 years and in the behavioral health field for over 25 years. I'm a licensed professional counselor and a certified professional counselor supervisor in the state of Georgia. And I'm very happy to be with you this morning to talk about what Georgia has been doing to respond to 988 and plan for its implementation and rollout. So as the State Behavioral Health Authority, DVHDD has taken on the lead as the agency for 988 implementation. We have a robust internal group that is engaged in a number of different activities and focus areas to plan for the 988 rollout. But we also recognize the need to get input from the community. And so over the past year or so, we've gathered a planning coalition and had a number of meetings. The members of the planning coalition are extremely diverse. They include our 911 partners, law enforcement and EMS partners. They include crisis providers, healthcare providers, advocates, and some of our brother and sister agencies as well. Next slide, please. This work group really dug in and did a great deal of work around those three subject areas that Monica discussed. So they identified system gaps in our current system so that we can work towards improving that with the rollout of 988. The key features, the key themes that arose from those meetings, of course, no one's really surprised that workforce shortages is one of the main ones. Our field, like many others in the past several years, have experienced significant workforce shortages. And so we're working with state and federal partners to identify best practices to overcome some of those barriers. They also identified the need for better coordination among the different partners that are involved in this work. I think about 911 and law enforcement, emergency rooms, and other groups that are currently involved in assisting individuals in a behavioral health crisis. And so better coordination among those partners will mean that individuals can be linked to the treatment they need in a more expeditious manner. They also identified the need to standardize processes and procedures so that they're all in line and able to meet people's needs. Training on those procedures as well as how the system works in general is very important. And then they also identified the need for public awareness about crisis services in general, as well as success stories for people that have experienced a crisis situation and move forward in their recovery, not just in the crisis system, but also in the follow-up outpatient services, as Monica was mentioning earlier. I want to draw your attention here to a statistic. So in FY21, the Georgia Crisis and Access Line received 275,000 calls, texts, and chats. That was a 24% increase from FY20 and the highest number of calls since the inception of GCAL. So before I move in and shift to talking about future projections of our data, I do want to make you aware that these projections were shared with us by some of our federal partners. And they're based on estimates of what they think could come once 988 starts. What we are going to continue to do as an agency and with our partners is to monitor utilization of 988 as the rollout happens and after, so that can inform our planning around building capacity needs. So I mentioned just a moment ago what our current state was, or the state in FY21 in terms of call volume. And based on the federal projections, we expect that call volume is going to double after the rollout of 988. And again, as I said, we recognize the need to be very mindful of monitoring the data so that we can be responsive with adding capacity as needed. Next slide, please. This slide focuses on our mobile crisis services. So again, in FY21, over 20,000 mobile crisis response dispatches were made and people received services. And we expect that number to increase significantly in FY23. Next slide, please. And the downstream effect, of course, of people using 988 and mobile crisis response is that we can anticipate a greater need for community crisis beds. So in FY21, over 32,000 admissions happened with our Georgia state-funded crisis beds, and we expect that that number to double as well in FY23. So I'm going to hand it over to Wendy Tigreen, and thank you for your time today.
Good morning, everyone. I'm Wendy White-Tigreen, and I work for the Department of Behavioral Health and Developmental Disabilities as the Director of the Office of Medicaid Coordination and Health System Innovation. I'm a social worker, and I've been with this department for 28 years. And before that, actually worked in direct service delivery in community mental health centers. So like Monica, this has been my career passion. So I'm so glad to be with all of you today and share this exciting news. As Dawn was sharing in her past few slides, she was talking about where we are now and then where we've got to go. And so take a look at our current expenditures here. So the citizens of Georgia and our leadership have invested significantly in our crisis services infrastructure over the course of time. And so we feel like we have a lot of deep and good experience and are grateful to so many of you for some of this work that is going on throughout the course of the years and even today. So you see a pretty hearty investment, $235 million over the 3 buckets of content that all of us have been speaking with you about. Next slide, please. And yet we have miles to go before we sleep. For the future, as Dawn was talking about the volume increases on each of the major service delivery lines for the crisis response system, these are the numbers that we are now looking at in the future for need in our next few years in terms of expanding our capacity. So another additional $283 million that we are looking at for needed investment in order to meet the projected demands that are being set forth. And again, these are based on federal projections from SAMHSA and through their vendor who's administering the National Suicide Prevention Lifeline. And so we have a significant work to do ahead of us. Next slide. So actions that we are already taking as an agency. So there are several things that we are working on currently that I'm going to be previewing over the course of the next few slides. And so we really are focused, laser focused on increasing our current capacity and our current agility. And we are doing this quite rapidly. So completed, we've been working on a lot of telehealth solutions and have had the foundation of the massive pivot we all did during the pandemic to strengthen our telehealth technology and to strengthen our use and skills of technology such as this to communicate and engage with individuals. Additionally, we are enhancing our call routing procedures to prioritize the right people being on the phone in the right situations. Again, underway, we have a lot of work underway for the call center technology to, again, promote access in the fastest and most expeditious way possible, including not just for our call centers, but also the connecting technology that is necessary between the call center and mobile crisis. Next slide. So we are already beginning the new investments in this body of work. And so I think it's important to denote that our state leadership has made a significant commitment in the knowledge and understanding of what is forthcoming, and the federal government and Congress. And we are all ramping up for those bodies of work as well. And so for our FY22 budget, you see that there have been significant investments to begin some planning and IT growth, as well as some direct service work that you see in our FY23 budget related to our crisis infrastructure, particularly beds and investments in the call center. And then you see federal funding. There have been many grants that have been being released for the states in order to begin the foundational expansion that is necessary. And we are most pleased to announce that just this week, there's been a $2.9 million, so almost $3 million that was just awarded to the states. The state of Georgia in particular is the $3 million award so that we can build out further our call center capacity. Next slide. And as Monica indicated, and you will hear from us again and again, our best approach to mitigating crisis is for individuals to be in service, to get preventative and early intervention before there's a crisis. And when there is a crisis, having a services infrastructure post that crisis to continue some stabilization, to continue health and wellness, and to promote recovery-oriented service supports. So you can see here the significant investment that has been emerging just in the past year and going forward in terms of our funding that we are committing to the outpatient infrastructure that is so crucial for Georgians. Next slide. And then we are, again, already pointing our eyes to the horizon with projecting the demand and capacity needs. So you saw some of the budget work that was being discussed. And if demand were to happen the way is projected, those budget projections are for the next year. And so thinking about significant demand and capacity needs. So we are studying with rigor what our use trends will be. We are looking towards the federal standards that are being released this month for what are the expectations around the crisis infrastructure. And they are doing so through what's going to be called a federal playbook for the 988 service capacity. The marketing strategies. So right now, the federally driven marketing strategy is slated to be rolled out next summer, so 2023, anticipating that states are just beginning the capacity build, which is going to be needed to be responsive to the call volume increases. And of course, we are significantly impacted by workforce shortages in the behavioral health industry. And so we have a lot of work and investment that is going to be necessary to be sure we have a workforce that can meet these current service delivery needs, crisis stabilization needs, and the recovery needs of Georgia's citizens. So Monica, I'm going to kick it to you at this point.
Thank you, Wendy, and thank you for that very thorough overview. The only other thing I want to add as it relates to this slide is I think it's an important point of discussion. So while the federal legislation not only put 988 into law, it did also allow for states to implement monthly fees on telecommunication bills. Some states have done that. They've moved forward to add those fees. But given the variable circumstances around implementation and the potential implications of asking for additional money from families in the state of Georgia, we've decided to continue to assess actual volume related to the calls that may come in, that will be coming in, and to determine how best to really approach funding this type of long-term transformation of Georgia's crisis infrastructure. We have a lot of projections. We have spent a lot of time trying to anticipate what we think will be on the horizon, but with additional time, we will be able to better form that projection and make it into a better ask. And so we have not been a state that has decided to do that until we have a little bit more time to really truly assess the impact that is on the horizon for us. Next slide. So for the sake of time, I'm not going to read everything that's in front of you. You can see this slide, and these slides will be available. But as we think about how do we continue to communicate from here and what that looks like for next steps. So again, we're going to be focusing on keeping the stakeholders informed, gathering input from stakeholders, and continuing to educate about what is coming and what is happening, and also educating traditionally at-risk populations. And you'll see some of that outlined here in the graphic towards the right. And then again, I feel like it's a great way for me to bookend kind of some of my opening comments, which is we're going to continue to focus on this work. It is transformational. It is a huge change, and it's going to really impact the behavioral health system of the future. But at the exact same time, we will continue, and we'll need everybody to stay very passionate and diligent around the non-crisis parts of the system. There are many ways in which people can be connected to behavioral health supports, and it does not have to happen when one is in crisis. So we want to continue to focus on prevention. We want to continue to making sure that there is also capacity to address and support the needs of individuals prior to the crisis happening. Similar kind of an analogy, 911, there are steps that you can take and things you do before it becomes a 911 situation. And we want to continue to emphasize that our system is not just about when you are in crisis. Next slide, please. So of course, I would be remiss if I did not end this with saying, so right now, you can contact our GCAL line if you are experiencing any type of behavioral health crisis or suicidal ideations or anything under that umbrella. We have that active right now. So you continue to contact GCAL at the number there. If you have not done it, it's on my phone. If you have never downloaded the My GCAL app, please do so. It is available. And of course, our GCAL line is available 24 hours a day, 7 days a week. Thank you.
Okay, so that concludes the information we had prepared for you all today. Before we move to Q&A, I just want to take a moment and say I hope at least the main takeaway that everyone got today, that our 988 planning is a 2-track system. Of course, we are focusing on enhancing the capacity and the functionality of our call centers, all the way down to our crisis receiving centers, but we will continue to keep our eye on the ball for core outpatient services so that we don't push people to enter the system at the point of crisis for the first time. Now, I want to make sure before we move into Q&A that everyone knows where to look for updates after today. This week, we launched 988ga.org. The content on this website is being vetted and informed by feedback from a small coalition of our stakeholders. Some of you are on the line today, and I just want to take this opportunity to thank you for your work and thank you for your feedback. We've already incorporated into some of the website we have so far. Now, right now, we have some very basic information on the website and a set of frequently asked questions that already exist based on what we know. And we will use it today to answer key questions that were provided on the webinar, so it will be updated after the webinar today. And now we can move into our Q&A, which will be moderated by Wendy Tygreen.
Hello, everyone. Thanks for the robust dialogue that is in the Q&A in the chat. We're so glad to have all of you engaged in this critical process. So several of these, you've asked some of the similar questions, but I'm going to consolidate some of those together so that we're able to get to as many of your questions as possible. So let me offer this one first. So, and Dawn, I'm going to point this one towards you. When do you, DBHDD, I presume, plan to launch the marketing campaigns and advertising for the public for 988?
Thank you, Wendy. So as was mentioned during the presentation, SAMHSA has advised the states to hold off on broad marketing for 988 at least until July of next year, 2023. I think that every state has expressed capacity concerns as we roll out 988 and build the infrastructure. That said, we are going to need targeted education with law enforcement, hospitals, and groups that are traditionally at high risk for suicide, as well as their families, in a more hands-on personal marketing and referral type approach.
Thank you, Dawn. And so for our next question, and there have been several versions of this question. Will the GCAL phone number go away? And if so, when? Anna, do you want to take that one?
Yeah. Hi, Wendy. I had to get off mute. I'm Anna Borg. I am the Director of the Office of Provider Relations and ASO Coordination. And I've been in the mental health field for 27 years. I'm a little over Monica, a little less than Wendy. I'm right there. And I've been with DBHDD for 9 years. I have a master's in conflict management, and I'm a Lean Six Sigma Black Belt. So that I haven't been introduced, I want y'all to know who I am and who's answering your questions. GCAL will continue to operate its 1-800 number for the next foreseeable future. 988 is a augmented service to what's already there. It is a change in the National Suicide Prevention Line, but we will continue to operate the crisis and access line, the 1-800 number, as well as the text and chat. Those things are not going away with the rollout of 988. They are going to continue to be available to all Georgians as they are now.
Great. And Anna, if you don't mind just staying on the line for the next question. GCAL wait times have been a challenge every now and then in the past. How are you going to manage and consider call volume for the future?
I am really glad you asked about that. We at DBHDD have been working to reduce the hold times on the current GCAL line and have seen some positive results of our work over the last 2 months. 90% of our calls have been answered in less than 60 seconds. That's been the focus right now, is to make sure that we're able to manage the current capacity. You saw the capacity shift over the last year. So we are working on what it will look like for the next capacity shift. So twice as many calls roll out of 988. Well, we're going to work toward exploring how we can partner with other warm lines, 911 providers across the state, so that we can make sure that that volume gets addressed. There is a 5-year plan that we're working toward, but again, remember, it took a really long time for 911 to be where it is, And so it's a process. We're going to get there.
Great, thank you, Anna. I'm going to read this next question. Will this be available to those who are duly diagnosed? Specifically, the questioner mentioned those with autism. And the way DBHTD is considering this is that a lot of individuals who are in the community don't always have the discernment to know what is a mental health crisis or a substance use crisis or an autism crisis. And so very similarly to how we have considered the Georgia Crisis and Access Line in the past and have allowed those calls to come through. For 988, while it's not targeted to those populations in any way, we understand that calls will likely route through to 988. And as such, nationally, several of the national associations who promote autism treatment and support, as well as IDD supports, have been partners on a national level with us. And so we will continue to better understand that, to consider policy around this, and to have ongoing communication. So a 988 call would not be turned away for those individuals, but there would be triage and screening and discernment made by the call responder to better consider how to mitigate those crises. Okay, so I took that one, right? So we do have the next question, which are, who are some of the stakeholders for the Georgia 988 work? So I'll just throw that out to the group because that's very broad.
Yeah, I can take that if you'd like, and y'all feel free to chime in if I miss anyone. So we have a very broad group. We have our partners from 911, law enforcement. We are working with our provider network. We are also working with private hospitals and our advocacy groups in Georgia. Another main group that we're working with is a group of people that represent some of the high-risk populations. And that's some really important work that we're doing so that we're ensuring that our planning for 988 is inclusive of the needs of those particular groups. So we've convened a large group of stakeholders, partners that represent young people, older adults, veterans, LGBTQ, and other types of groups so that they can inform us in our work. Wendy, Anna, did I forget any groups?
I don't think so, Dawn. Anna, did you think of any additional?
No, I'm going to say at all because I'm sure it's a large group. It's multiple stakeholder groups that we're working with. So just a kind of there. If we forgot someone, we apologize. We want to be as inclusive as possible and ensure that we're getting as many voices to the table as we can.
The one other thing I think we should probably highlight is the Georgia associations who do emergency response, 911, the call centers, and they have been extraordinary partners with us, meeting more regularly with us than we should be honored to have them do so. It is so significant, their commitment to this significant partnership that is underway.
Our planning coalition slide will be available on the 988ga.org site that was referenced earlier after today's webinar.
Thank you, Monica.
For the full list.
Yeah, there's a question about will rural communities have access as well? I can go ahead and take that one, team. The answer to that is yes. The law asked all telecommunications vendors to have 988 active in July of this year. And so when you call 988, it will route to a 988 call center, which in Georgia is the Georgia Crisis and Access Line. So certainly, yes, as long as you have any kind of telephonic connectivity, you have that capacity to engage with 988. So here's another question, and this there's several questions related to this. So let me I'm going to consolidate them in terms of words. But the concerns and questions about like how geolocation, if you have an area code not from Georgia, how is that call managed, and the like. So who wants to lean in on that one from our team?
I can take that. So currently, calls as they're routed to the National Suicide Prevention Line, and in the future for 988 for the foreseeable future, it is based on your area code. So if your telephone number has an area code that is not a Georgia area code, then that call would be routed to the call center through the National Suicide Prevention Line 988 in the future, to that state. That state would then route that back to us as appropriate and possible. That is a limitation of the current National Suicide Prevention Line. They are looking at technology to be able to use geolocation in the future, but that will not be available July. That is something that we are all working toward at the national level and helping them partner with what that could possibly look like, but that is not going to be available July 1st. Or July 16th, sorry.
And then there's a few questions on what is the age range. And so will it cover all ages? And the answer to that is yes. So I'll go ahead and take that easily. And certainly as we proceed, we are considering with federal leadership related to children's mental health and even other specialty target groups that we've been mentioning before, but there may need to be unique and targeted specialized responses to particular age groups. And so we will be refining our tools as we go to work better to support these individuals. So aging population, some of the very specific target populations that we mentioned. So for instance, individuals who may be deaf, and then youth, that particular target group. And of course, we use the text chat capacity in Georgia. It was originally like set forth, right, thinking that the younger generation uses that capacity a lot more, but we've seen all ages use that technology. But we will continue to refine those specialized responses as we move forward. But yes, available to all ages. Is there a plan for a text option for 988 and app similar to the GCal line? So Anna, do you mind taking that one?
I do not. There will be a text chat function with 988. It will be 988. You text chat to 988. You will not need an app to do that. And there was an app, a question earlier about, is there an app now? In Georgia, there is a MyGCal app. You can do it on Apple or Android. Go to your store, type in MyGCal, search MyGCal app, and you can download the text chat app that we currently have in Georgia. But 988 will have text chat functionality through the number 988. I think that goes live maybe in November, Wendy. I'm not sure of the go live date on the text chat functionality. It will not be July, but.
Right. No, November is what we've heard. So we're planning for 2023, just technology. We're trying to be prudent with our wisdom. We're going to take just a couple more questions and consolidate those, just so we give ourselves time for some wrap up. The next one is, are there plans to increase funding for the peer warm lines? And so I think you heard Monica lean in and say that we're going to have to be highly invested in those. And so we have hopes for that expansion as we receive additional funding. Monica, I'm not sure if there's anything you want to add to that. Okay. And then finally, there's I think a great question about in this interim time, right? So we're kind of, the launches have been, the rolling start, the beginning of the 988 line is starting in July. And the question is, how do we talk to the individuals we serve now about what number they should call in the event of a crisis?
Well, I can take that if you'd like. We should inform people to continue to use the Georgia Crisis and Access Line or the current National Suicide Prevention Lifeline number to reach out for services, because both of those can help get them a local response. After the 16th of July, they can use 988 as well. We look at it as a no wrong door approach. So any of those numbers that you call will link you to the Georgia Crisis and Access Line here and allow you to seek assistance.
Well, thank you so much, everyone. There were several other questions coming in furiously right there at the end. And we won't have all the time necessary to get to those today, unfortunately. But know a couple of things from us. The Q&A are very important to us because we want all of you to continue to be our informed constituents. And so we will be working to answer the questions that have been provided by you today and provide answers for those in the near future on the website that you see here. So let me just kick it back over at this time for us to begin to wrap up our time together.
Thank you all again for joining us today. As a reminder, and as Wendy just said, key questions asked on today's webinar, and even those that we didn't have time to answer live, will be captured and become a part of our FAQs at 988ga.org. And of course, if you think of a question after today, you can go to 988ga.org and use our inquiry form, which is questions@988ga.org. That FAQ is responsive and it will update live on the website with questions and answers as you ask them. So if someone has already asked a question that you have, you won't have to wait for an answer. The answer will come to you already. Again, thank you all for joining us today, and look for future information from the department as we move toward July. Thank you and have a good day.